A fall, a simple trip, and in just 1 second, everything changes. Did you know that a hip fracture can leave an older person bedridden for months? Or even make it so they never walk the same again? In many cases, that fall doesn't just affect the body. It also impacts independence, confidence, and the freedom to move without fear. Welcome to Vital Steps, the space where we care for what matters most: your health, your movement, your life. Today, we're going to talk about something that can change your future, or even save it. And the most shocking part, many of these fractures can be prevented, without spending money, without pills, and without going to the gym. Dr. Adler is here with us to share 5 simple exercises, no weights, no machines, that you can do at home in under 10 minutes. Exercises designed to protect your body, strengthen your bones, and improve your balance. And stay tuned, because later in this episode we'll discuss the best time of day to do them, how to pair them with breathing, and which mistakes you must avoid to prevent injuries. Welcome, Dr. Adler.
Thank you. It's a pleasure to be here again. And yes, what we're about to share today could mean the difference between an active life and a life limited by a fall. The truth is harsh, but clear. Every year, thousands of older adults lose their independence due to fractures that could have been prevented. And many times it's not about age, it's about preparation. And the most important thing, you don't need to make huge efforts. Just a few minutes of daily movement can act like a natural shield for your bones, your muscles, and your stability. We're going to teach you 5 exercises that are easy, safe, and powerful, but most importantly, designed for real people. You don't need to be agile, young, or have special equipment, just your willpower and a little space at home.
This episode is especially for you if you're over 60. You've noticed it's getting harder to keep your balance. Or you know someone who's already had a fall and doesn't want to go through it again. And if you haven't had one yet, even better. Because preventing it now is the key to living freely tomorrow. Doctor.
We're going to talk about exercises made for real people with real bodies. No experience needed, no flexibility required, no need to move like those people in viral videos. And even though they may seem simple, these exercises are backed by science. Because what's at stake isn't just your mobility, it's your independence. Did you know that 1 in 3 older adults suffers a fall every year? That's what the Centers for Disease Control and Prevention, CDC, in the US reports. And here's the most alarming part. Out of those falls, 1 in 5 results in a serious injury, like a fracture or a head trauma. But here's the hopeful news. A review of 59 scientific studies published in the BMJ in 2019 concluded that regular physical exercise programs reduce the risk of falls in older adults by 23% to 31%, especially programs that combine strength, balance, and coordination, just like the ones we're about to show you today. Even if practiced just 10 minutes a day, the benefits add up. Leg strength improves, confidence while walking increases, and the body relearns how to react better to a trip or loss of balance.
So, just moving a little each day could be the difference between continuing to walk or ending up in bed.
Exactly. And that's why I invite you not to underestimate these exercises. They're gentle but powerful. This isn't a trend. It's pure prevention.
I remember Doña Clara, a 72-year-old patient who tripped over her own little dog. She ended up with a wrist fracture and couldn't cook or dress herself for 3 months. When she came back, she told me, "Why didn't anyone teach me this before?" That's why we're doing this episode today.
Because a fall doesn't give any warning, but you can prepare yourself. And these 5 exercises, they're your best defense.
Doctor, with all this introduction, let me ask you a question. As if I were a senior myself. Is a fall after 65 really that serious?
Yes, and I say that without exaggeration. A fall can lead to fractures of the hip, wrist, spine, and often it's the start of a chain reaction of decline. Studies from the National Institute on Aging show that after a hip fracture, 50% of older adults never fully regain their independence, and 20% may die within the following year.
Wow, I had no idea it was that serious. What causes it?
It's a combination: loss of muscle strength, reduced balance, and slower reflexes. The good news is that all of this can be reversed with specific exercises, which we're going to teach you today.
Doctor, why is this such an urgent topic right now? What's happening with falls among older adults?
Because falls are no longer just minor accidents. They're a true silent public health crisis, and the consequences can be devastating.
Are we talking about fractures?
Yes, and not just any fractures. The three most common fractures in people over 65 are hip fractures, wrist fractures, and spinal vertebral fractures. And each one brings very serious problems.
Let's talk about hip fractures. I've seen patients who never walked the same again.
And you're right. A hip fracture often means surgery, immobility, loss of independence. And the hardest part, 1 in 4 older adults who suffer a hip fracture dies within the following year. Not from the fracture itself, but from complications like infections, blood clots, or even depression due to loss of autonomy.
And what about the wrist? People sometimes think it's not that serious.
It might seem minor, but it can be incredibly limiting. Getting dressed, eating, cooking, daily tasks become impossible. And often the body doesn't regain the same strength or flexibility it had before.
And what happens with spinal fractures? Doctor,
Vertebral fractures can be silent. Sometimes there's no fall, just a sudden bend or a wrong move. But the pain is intense, and it affects posture, balance, and even breathing. And if not treated properly, they increase the risk of future fractures.
so it's not just about the broken bone, it's everything that comes after.
Exactly. After a fracture, many people lose confidence, isolate themselves, and move less. And that's when the vicious cycle begins. Less movement, Rashan, higher risk of falling again.
That's why these exercises aren't just another suggestion. They're an investment in your health, your independence, and your quality of life.
And the sooner you start, the better. It doesn't matter if you're 60 or 85, your body will always respond to movement.
Let's get straight to the point, Doctor. What are those exercises?
Let's go over the 5 most effective exercises for adults over 65. No impact, safe, and backed by clinical studies. Take notes or share this with someone who needs it.
Before we move on to the exercises, let me ask you something, Doctor. What movements should we not be doing, especially for older adults? Which ones increase the risk of falls or injuries that we could avoid?
Great question, because very often we see viral exercises online or poorly adapted routines that can be dangerous. For example, high-impact jumping or jogging. Even if they seem good for cardio, they increase the risk of imbalance, especially with knee or hip issues. Deep knee bends or poorly performed squats. These can damage joints if not done with proper technique. Sudden neck or back movements. These can lead to dizziness or muscle strain. And a classic one I always warn about: balance exercises without support. Many people try to stand on one leg without holding on to anything, but without prior practice, that often ends in a fall. My recommendation is always this: if an exercise makes you hesitate, it's better not to do it alone. And when in doubt, choose something simple but safe. The most effective way to prevent fractures is to strengthen and mobilize without compromising your balance.
That's so good to know. And Doctor, what could happen if someone ignores these recommendations and goes ahead with risky exercises?
A few months ago, I treated Marta, a 69-year-old patient. She had started following a workout routine she saw in an internet video: jumps, deep squats, and balance moves, all without support. In just 2 weeks, she twisted her ankle trying to stand on one leg without holding on. And the worst part? She had already suffered a fall the year before. When I saw her, she said, Doctor, I just wanted to get stronger. I thought if those girls in the video could do it, I could too. And wanting to move is not the problem. The problem is pushing yourself beyond what's safe, because an injury at 30 is not the same as an injury at 70.
Exactly. Sometimes, trying to move fast sets us back months. Better to go slow, but safe.
Exactly. The best exercise is the one you can safely do every day, not the one that leaves you resting for a week because of a wrong move.
These stories are so valuable, Doctor, because they show how knowledge and guidance are crucial at this important stage of life. Doctor, what exactly changes in the body with age that increases our risk of falls and fractures?
Great question. There are three major natural changes that happen as we age, even if we don't always notice them. We lose muscle mass, we lose bone density, and our reflexes and balance decline.
So we become more fragile and slower, even if inside we feel the same as before.
Exactly. And that's what makes it tricky. Many of these changes happen silently. A person feels just fine until a simple trip leads to a fracture. Then comes the shock, the fear, and often a long recovery that could have been avoided. After age 60, if we do nothing, we can lose between 3% and 8% of muscle mass per decade. And our bones become more porous and fragile, especially in women after menopause. That's what we call osteopenia or osteoporosis.
And that happens even if the person doesn't feel any pain?
Yes, absolutely. That's the issue. There are no clear warning signs. And on top of that, our balance isn't the same anymore. The soles of our feet lose sensitivity. Vision can worsen in low light. And the nerves that tell our brain where our body is slow down. All of this means walking on uneven ground or climbing a step in the dark becomes more dangerous than we realize.
Right. A small distraction or a misstep when getting out of bed can lead to a serious fall.
And the hardest part is that sometimes one fall changes everything. A hip fracture, for example, can result in the loss of independence. That's why I always say, it's not about scaring ourselves, it's about being prepared. With small daily exercises, we can reverse many of these changes. That's the good news. Absolutely. And add to that things like drowsiness from medication, poorly adjusted glasses, improper footwear, or homes full of obstacles.
So the risk isn't just from age, but from a combination of many little things.
Exactly. But here's the good news. Even if we can't stop time, we can train the body to react better. And that's what we're going to share in this episode. A short, safe, and powerful routine to strengthen muscles, improve balance, and protect your bones.
So now, with caution, let's get into the exercises that really help, right? Doctor.
Exactly. Let's begin with the first one. 1. Wall sit, invisible chair. 2 minutes. Lean your back against the wall and lower yourself slightly, as if you're sitting in an invisible chair. Hold the position for 10 to 15 seconds. Come back up and repeat. This strengthens your thighs and glutes. Key muscles for walking with stability. 2. Heel raises, 2 minutes. Hold on to a chair and lift your heels several times. This improves balance, strengthens your calves, and helps prevent tripping.
I love this one. It's super simple, and I can feel it activating my legs. And I imagine it also helps you feel more secure going upstairs, right?
Exactly, it strengthens the ankles and activates stabilizing muscles. And it doesn't just help prevent falls, it also improves posture and circulation. Let's move on to the next exercise, number 3. 3. Marching in place with arms raised, 3 minutes. March gently, lifting your knees and raising your arms toward the ceiling. This activates coordination, balance, and blood circulation. Nurse, doctor, could this also work as a mini cardio workout? I imagine it gets the heart rate up a bit. Great observation. Yes, it's a gentle way to activate the cardiovascular system. And best of all, by moving the arms at the same time, we also stimulate the chest area and boost brain oxygenation. It's ideal for starting the day with energy.
Let's move on now to the fourth exercise, Doctor. 4. Gentle waist twists, 2 minutes.
Stand with your feet apart, Hands on your waist, gently twist from side to side. It improves mobility and helps prevent stiffness, especially in the back. 5. One leg swings, 3 minutes. Hold on to a table with one hand. Lift one leg straight in front of you, then swing it behind. This strengthens the hips and improves balance.
Doctor, I have to say, these last two exercises really surprised me. They're so simple that you'd think they don't do much. But once you try them, you really feel the difference. They're perfect for people who don't have the time or strength for long routines. Should these be done every day?
Ideally, yes, but even doing them 3 or 4 times a week already makes a big difference. The important thing is to make them part of your daily routine, like washing your face. Just a few minutes a day can protect your body from a serious fall in the future.
Doctor, these 5 exercises are fantastic. I love that you don't need to go to a gym or have any special equipment or be young to do them. But now I have one very practical question. What's the best time of day to do them? And is there any way to make them even more effective?
That's an excellent question, because it's not just about what you do, but when and how you do it. And here's something I consider key, something we often forget: breathing.
So what time of day is best to make these exercises really work?
Great question. Science has shown that the best time to move the body, especially after age 65, is between 7 and 9 in the morning. That's when the body is coming out of its resting state, the joints need lubrication, and the brain is starting to activate. Moving during this time frame literally turns on the nervous system, like starting the engine for your day.
Of course, it's like giving the body a cup of coffee. Without the coffee,
Exactly. And there's one more way to make these exercises even more powerful:
even more than that? How?
by combining them with mindful breathing while you do each movement. Inhale deeply through your nose and exhale slowly through your mouth. This simple practice lowers cortisol levels, the stress hormone, oxygenates the muscles, and helps maintain bone density. All that just by breathing correctly.
No one ever says that. And yet, it's so powerful.
Breathing is an ancient biohack, and when you combine it with movement, it becomes pure medicine for your bones, your mind, and your energy.
And if you're wondering what exactly a biohack is, we explain it thoroughly in the previous episode. Look it up. Gentle biohacking for seniors over 65. Is it effective or just a trend? There you'll discover how small changes can transform your health from the inside out. And what if someone has limited mobility or is afraid of falling?
It can be adapted. Do it while sitting. Use a chair for support. Start with just 1 minute a day and increase gradually. And the key: celebrate every improvement. Remember, you're not competing with anyone, just moving toward a better version of yourself.
Doctor, after everything we've talked about, do you have an example of someone who improved their mobility and prevented falls using this routine?
Absolutely. Let me tell you about Mr. Pedro, 76 years old. A year ago, he was afraid to walk alone because he had already fallen twice. He didn't even want to go out to the yard. We started with this same 7-minute morning routine. At first, he only did 3 exercises while seated, but the important part was that he did them every day. 2 months in, he could already stand up without support. And the best part was that after 6 months, he told me with a smile, "Doctor, I started walking my dog again, and my back doesn't hurt."
That's so inspiring. Proof that with consistency, the body responds, even after 70 or 80.
Exactly. The aging body isn't broken. It just needs to be activated, gently and with care.
Doctor, we've already talked about exercise, but we know fractures don't depend on movement alone. What else can we do at home, day by day, to keep our bones strong and prevent accidents? Doctor,
Great that you brought that up. Falls don't always happen because of weak muscles. Often the danger is in grandma's rug. Laughs. Here are 3 key tips beyond exercise. Vitamin D and calcium, the classic combo. But be careful. Not everyone needs supplements. First, talk to your doctor and get tested. I remember a patient, Mr. Carlos, who took supplements on his own and drank 2 glasses of milk with every meal. The result? Calcium overload, stomach issues, and confusion. Moral of the story, not too much, not too little, just the right amount. Check the house, seems simple, but it saves lives. Remove loose rugs, improve lighting, install grab bars. One of my patients, Teresa, kept falling in the same hallway. Know why? She had a poorly placed mirror and
She was startled by her own shadow every night. She ended up removing the mirror, and the falls stopped. Laughs.
3. Train the mind. This one is powerful. Many falls happen due to fear of falling. When you're afraid, your body tenses, and when you're tense, you lose balance. Confidence can be trained with practice, support, and small wins. It's not about denying fear, but learning to walk with it until it gets smaller.
That's so important. Sometimes we think it's only physical, but the mind can stumble too.
Exactly. And when the mind is strong, the body responds better. That's why I always say, taking care of your bones also means taking care of your thoughts.
Doctor, in the last episode we mentioned something that really stuck with me. Listening to your body and your thoughts.
Great point. The best biohack to prevent fractures is to listen to your body. How are your knees feeling today? Do you feel steady or off balance? What is your breath telling you? That level of awareness lets you make adjustments before an accident happens. And also, watch your thoughts. Because if you keep saying, I'm going to fall, or I'm getting old, your body reacts with fear. But if you think, I'm getting stronger, or I can improve, your body responds.
Doctor, we can't talk about bones without mentioning calcium and vitamin D. What role do they actually play?
Crucial. They're like the bricks and cement of your skeleton. Calcium is the main mineral in bones, and vitamin D helps your body absorb that calcium. Without vitamin D, even if you eat calcium-rich foods, your body won't use it.
Effectively. And what happens with older adults when it comes to that?
With age, the ability to absorb vitamin D decreases, especially without enough sun exposure. Also, many older adults eat fewer dairy products or calcium-rich foods due to digestive issues or other reasons. This leads to a double problem. Not enough calcium in the diet and poor absorption of what is consumed.
And that weakens the bones over time?
Exactly. It increases the risk of osteopenia and osteoporosis, making bones as fragile as crackers. A simple fall could result in a hip fracture, and that could change a person's life forever.
So, what's recommended? More dairy? Sunlight? Supplements?
It depends on the person, but in general, get 10 to 15 minutes of daily sun on your arms and face without sunscreen. That's a natural source of vitamin D. Eat calcium-rich foods like dairy, sesame seeds, sardines with bones, almonds, and broccoli. If there's a diagnosed deficiency, the doctor may recommend supplements, but never self-medicate.
And together with exercise, that really strengthens the bones?
Yes, calcium and vitamin D provide the raw materials, and exercise gives the stimulus to use them. It's like having bricks and cement, but you also need workers to build with them. Gentle movement and weight-bearing activity trigger bone renewal and keep
Them strong. I love that. Strong bones, not just from what we eat, but from how we move. Dr. Adler, what an eye-opening journey. Today, we didn't just learn how to move. We learned how to take better care of ourselves.
And that's what matters. At this stage of life, it's not about doing more. It's about doing it better. The right movement can change your entire year or prevent a fracture that might leave you bedridden for months. After age 65, every step you take is an investment.
And if you know someone who needs this message, a family member, a neighbor, a friend from the community center, share this episode. It could prevent a fracture or even save a life. Doctor, I'm left with one clear idea. Prevention isn't expensive. What's expensive is not preventing.
Exactly. A few minutes of movement, a simple routine, a daily decision can be the difference between living independently or depending on others.
And this isn't just about avoiding fractures. It's about preserving dignity, the freedom to move, to go out, to hug, to dance, to keep enjoying life without fear of falling.
Exactly. And it doesn't matter if you're 65, 70, or 80, you can always start. The body is wise. It responds when you give it what it needs.
And for those who want more, heads up. The next episode takes us straight to the kitchen. Yes, we'll talk about a silent enemy that many people have on their plates every day, and how an anti-inflammatory diet can change your energy, pain levels, and even your mood. Do you feel bloated, tired, or have digestive discomfort that didn't used to be there? What you're eating might have more to do with it than you think.
And we're not going to talk about impossible diets. We'll offer simple, practical, and even delicious steps to eat better without suffering.
So don't miss it. Subscribe now to our YouTube channel at Vital Steps and turn on the bell to get notified. Because what you eat can be your medicine or your poison.
And as I always say, it's not about doing it perfectly. It's about starting, even if it's just one vital step.